pharmaceutical marketing now really has the ability of bringing the real world health data into the linear TV planning place, right? So TV has always been huge for the pharmaceutical category. It's very important and remains important for the awareness. That's never going to go away. But what the data is allowing us to do now is to inform a data-driven linear strategy, and then being able to carry that same strategy that is used for linear TV across CTV, addressable TV, programmatic channels, social, and other digital media. So it's really helping build and bridge the fragmentation of the media ecosystem.
Tell us who Swoop is and what do you do?
Yes, well, what Swoop is today is very different than what Swoop was for the past near like a decade. Swoop is about nearly 10 years in the market. We are the leading provider for healthcare audience segments, right? So we set the standard for privacy compliant, high performing DTC segments. We have since evolved. We do not only audience segments, but we also do HCP segments. We have conversation AI chatbots for the brand.coms. We have communities, over 60 condition-specific communities. So becoming much more than just the patient, but really a platform where we can help connect brands, HCPs, and patients safely across all the different segments.
For all those reasons, pharma has been particularly cautious compared to other kinds of brands.
Yeah.
Particularly with a focus on the presence at Cannes. What are you seeing from pharma marketers in terms of their presence here and their interest in emerging media?
It has grown tremendously. I remember when I first started planning Cannes for pharma-specific companies, it was very little brand direct presence in Cannes, right? It was really about the agencies and the creative that they were doing, but the brands themselves, they were not here. Fast forward to today, a lot of the C-level executives from the brand direct, they are here. They are part of the conversation. They really want to make sure that the industry is hearing their needs, and they are addressing, like how can we continue to help patients learn about life-saving treatments and drive awareness and improve the quality of life, and in a privacy safe way.
Have pharma brands, have they retained their cautiousness, or have the tools such as the ones that Swoop necessarily offers, have they become better at managing that cautious sense that pharma needs to have?
I don't think that they would ever stop being cautious, right? We are all cautious. We are all highly regulated. I would say that what is changing is the level of comfort and knowledge within the brand direct partners that we have within the organizations, right? So they have people within their teams that are privacy experts. They actually understand the privacy law. They have people that understand the technology. So they are working not with traditional lawyers and MLR, but they're working with people that not only understand the legal side, the regulatory side, but they also understand the technology and the nuances of the privacy. And they are trying to find solutions, not just blocking innovation, which has been really rewarding.
Absolutely. So platform interoperability, data fidelity are perennial issues, especially as pharma brands and other brands really seek to have this omni-channel presence in terms of connecting with consumers. So what are you seeing in terms of the recognition of that importance of platform interoperability, and maybe how is Swoop addressing that?
Yeah, so like my favorite thing to say is like, you don't have omni-channel without data consistency, right? I like to say that omni-channel starts with TV, and then omnichannel cannot happen unless you have the consistency of the data between TV, programmatic, linear, and then the measurement, right? So the way that we are doing, like we are platform agnostic at Swoop. So we partner with all of your linear TV, all of the distributors, the content providers, the DSPs, all of them, and the measurement platforms.
Marcella, I wanted to get your sense of the future of healthcare marketing generally, and how do you see the convergence of data, AI, and TV, and reshaping the way pharma brands think about their media strategies?
So what our AI platform enable people to do is they can take, for example, a healthcare provider list and identify all of the HCPs with non-adherent patients, right? So those are patients that are likely to drop from a prescription or they have dropped from a prescription. We can provide a list for our brand that help them inform their sales teams about those education needs with those specific providers, right? Like, so that is co-op program, right? Over 70% of co-op programs goes unused because of lack of education. So those are all the great tools that AI is actually doing, is like pulling those little nuggets of insights that can actually drive better patient outcomes, which before, like was just AI for the sake of AI, and now is actionable insights from AI.